Good morning, all. We are going to see the few chapters of biochemistry today. Rapid revision. Glycemic index of glucose. What's the glycemic index of glucose? Glycemic index is 1. 0.11, 1.52, but glycemic index of glucose is 1. What is glycemic index? It is defined by the area under 2 hours blood glucose response curve following ingestion of fixed percent. After taking a meal, after 2 hours, that glycemic index will determine that glucose values. Okay. After 2 hours after meal, range will be determined by the glycemic index of the food. Nowadays we are seeing no, what is the glycemic index of this food? What is the glycemic index of that food? Glycemic index for banana is high. Glycemic index for this one cornflakes is high. Ice cream is low. So ice cream is low, so we can take ice cream lot அப்படின்ட்டு we are deciding now. So that is glycemic index. If glycemic index is more means it will create more glucose level in the body, so it might present with diabetes. So uncontrolled the food will have that glycemic index. Okay, depending upon the intake of food, in each diet will have a glycemic index of low and high. Depending upon that, we can prescribe the diet pattern for diabetes people. Okay, so we have to see the glycemic index, then only uh, we have to instruct the patient, diabetic patient, to use this. We have to instruct the patients like apple, guava, that and all, apple, goya, madala, papali, like pomegranate, papaya, all can be taken for diabetic people because they have low glycemic index. But for mango, banana, it will have high glycemic index. We should not prefer that high glycemic foods for diabetic people. So that is the importance of glycemic index. So glycemic index of glucose is 1. Okay, next question. Low glycemic index food is, it has got slower up. That is, it has got what are the choices? Easily digestible, increases plasma glucose, has lower absorption, increases glycogen deposits. Among these, answer is slower absorption. So glycemic index, simple, compared to simple carbohydrate, complex carbohydrate will have slow absorption. Likewise, glycemic index low or glycemic index will have slower absorption. So only glucose level will not peak instantaneously. High glycemic index means it will increases the glucose instantaneously. So only we are advising the patients to follow the diet pattern, like they should have low glycemic index foods. Okay. So this is the, so glycemic index is nothing but the time course of postprandial glucose concentration from meal. Okay. So what is one more question, lowest glycemic index is watermelon, papaya, sweet corn, potato. Compared to this, sweet corn has got lower glycemic index. Okay. So most fruits and vegetables will have low glycemic index, like less than 55. Glycemic index of fruits and vegetables are less than 55. Medium glycemic index is 56 to 69. High glycemic index means more than 70. So papaya will have low glycemic index. We will advise the patient. Papaya will have lowest glycemic index. Yes. Video வரலடா. Compared to papaya, sweet corn will have lowest glycemic index, like 53 for sweet corn. Okay, we should not by seeing papaya, you should not answer as papaya. In spite of the patients being advised for taking apple, guava, papaya, and pomegranate, compared to this, sweet corn will have the lowest glycemic index of 53. Okay, among these fruits and vegetables. Okay. So glycine is formed from 3 amino acids. What are the amino acids? Sorry, creatine is formed from 3 amino acids. What are they? Glycine, arginine, and methionine. GAM. I told you in the class itself. Creatinine is formed from 3 amino acids: glycine, arginine, and methionine. You should not get confused with arginine, alanine. Likewise, you should not get glycine or glutamate. See, these two will have the confusion. So you have to know what is this. Glycine, arginine, and methionine is this is a very, very frequently asked question. Okay. Creatinine is formed from glycine, arginine, and methionine. What is the active form of methionine? What is the active form of methionine? SAM, that is S-adenosyl methionine. This is again another MCQ. So, what are the two MCQs in this? Creatinine is formed from arginine, glycine, and methionine. What is the active form of methionine? S-adenosyl methionine. Okay. G6PD deficiency leads to what are the what are, see the options: shock, galactosemia, hemolytic anemia, hereditary fructose intolerance. But here answer is hemolytic anemia. Why? Why hemolytic anemia? G6PD deficiency is an inherited condition in which there will be deficiency of G6PD. G6PD will be deficient. Okay. So it helps the RBCs to function normally. That is, it maintains the free radical scavenging effect. It is having free radical scavenging effect. It is decreased means it will causes lysis of RBC. So hemolytic anemia will happen if there is any exposure to medications like sulfur drugs or infections like malaria. Okay, all these will cause, and aflatoxins will cause the hemolytic anemia in G6PD deficiency. What are the vitamins required for synthesis of collagen? C. I told you in the class itself, C for collagen. C means collagen types. Vitamin responsible for regulation of synthesis of collagen is C, vitamin C. Okay. So, what are the collagen contains specific amino acids like glycine, proline, hydroxyproline, arginine. Glycine is a repeated amino acid. This is again one more uh, MCQ. Glycine is a repeating amino acid for in collagen formation. That is one question in this question itself. And vitamin C is the vitamin responsible for regulation of collagen synthesis. Okay. Then function of SGLT1. What is SGLT? Sodium glucose transporter 1. Uh, what is the function of SGLT1? Is to transport sodium, glucose, potassium, bicarbonate. These are the options. You should not click sodium. You have to answer glucose because this SGLT2, SGLT inhibitors like dapagliflozin, that gliflozins are all SGLT inhibitors. Okay. So these are prescribed to decreases the glucose level. So function of SGLT1 is to transport glucose. Okay, so it is a high affinity sodium glucose 4 transporter. It transports glucose and galactose along the luminal side of the enterocytes. It is responsible for absorption of sugar. So you have to know, you have to have a common sense. SGLT inhibitors are useful for decreasing the glucose level. So function of SGLT2, SGLT is to transport glucose. That's all. Types of fatty liver seen in kwashiorkor is fatty liver, cirrhotic liver, hepatitis or liver abscess, all these options are there. Fatty liver, why? Kwashiorkor means protein malnutrition. Protein deficiency is kwashiorkor. Marasmus means both protein and calorie deficiency. So they will be given diets like cereals, cassava, plantain, sweet potato, starchy food. Okay, they will have reddish discoloration, and will have dry skin, skin rash, pot belly, all will have it. And also there will be fatty infiltration of the liver. Okay, because of many enzyme immaturity because of decreased protein. So what is the where the protein is being synthesized in liver? It is synthesized. So the protein is small. There is deficient. So kwashiorkor will happen. So kwashiorkor, what type of liver disease? Fatty liver. Some enzyme immaturity will be there. So they will have the fatty infiltration. So common liver disease in kwashiorkor is fatty liver. Then for DNA fingerprinting, or for DNA fingerprinting, blood collected in which tube? But for DNA fingerprinting, glass bottles, syringes containing sodium fluoride, EDTA vials, test tubes with sodium chloride. EDTA vials are the best collecting tubes for DNA fingerprinting. Okay, sodium fluoride for glucose. Okay, but you have to know what is the for DNA collect. They will collect blood. Whole blood will be collected, and they will collect that in EDTA tubes. Okay, so fingerprinting, blood can be collected using EDTA tubes. Maximum biological value. What is maximum biological value? What is biological value? Biological value means protein getting absorbed. Protein, how much amount of protein ingested, getting absorbed and it's utilized by the body. That is maximum biological value. So biological value is protein is represented as nitrogen. No, so nitrogen retained by nitrogen absorbed into 100. Nitrogen retained by nitrogen absorbed into 100. That's biological value. So it will have what is the maximum biological value? Most of the animal proteins will have maximum biological value like egg. Okay, egg will have more biological value. Egg biological value is 94, milk 84, soybean 73. Even the soybean will have more protein, but animal proteins will have high biological value. Okay. Next, coming to atherosclerosis involves formation of lipid-rich plaques in intima of arteries, which can narrow uh, the coronary arteries, leading to decreased blood flow. Because of atherosclerosis, there will be decreased blood flow and hypoxia of the cardiac cells. So, which amino acid is associated with atherosclerosis? One is methionine, cystina, homocysteine, leucine. Homocysteine. If homocysteine is more, means we have to treat that patient with by giving folic acid. Okay, simple treatment. It will give greater benefit. Okay, for homocysteine, if the patient is having this atherosclerosis, if we check the homocysteine level, if it's high, means you have to treat with the folic acid. Okay, so homocysteine gets accumulated will cause uh, atherosclerosis of the vessels, major arteries like cardiac arteries, coronary arteries, then cerebral vessels, resulting in atherosclerosis and stroke respectively. Pulmonary embolism might happen if it blocks the pulmonary arteries. So homocysteine will bind with the endothelium of the blood vessels and activate signaling pathways, which leads to pro-inflammatory molecules, resulting in theroma formation and intravascular thrombosis. So homocysteine will have a deleterious effect. So it will cause stroke, atherosclerosis, pulmonary embolism, all. We have to treat with folic acid. Blood glucose levels cannot be augmented by mobilization of muscle glycogen due to lack of muscle lacks what enzyme? Muscle lacks what enzyme? Muscle lacks G6 glucose 6 phosphatase. So it's one among the important MCQ. Muscles lack glucose 6 phosphatase. That is a direct question, but they have asked here. Blood glucose levels cannot be augmented by mobilization of the muscle glycogen due to lack of. So muscle lacks glucose 6 phosphatase is a common important question. Okay, muscles lack enzyme glucose 6 phosphatase. So muscle cannot maintain the blood glucose level. Okay, but liver cells will have the enzyme, so they will maintain the blood glucose level. Next question. So muscle lacks glucose 6 phosphatase. Glucose can be synthesized from all except, that is, glucose synthesized from all means gluconeogenesis. Gluconeogenesis means synthesis of new glucose from substrates like amino acids, glycogenic amino acids, glycerol, lactic acid, pyruvate. All these are the substrate for gluconeogenesis. This is the question, direct question. What are the substrate for gluconeogenesis? Or the glucose can be synthesized from all except amino acids, glucogenic amino acids, glycerol, lactic acid, pyruvate. All are the substrates of gluconeogenesis. Okay, myocardium normally utilizes. Normally means in normal condition, myocardium utilizes what? Fatty acid. Okay, this is a very important slide. This is well-fed state la this liver will utilize what, skeletal muscle will utilize what, cardiac muscle. We have to see this. In well-fed state, all will consume glucose. All will need glucose except the cardiac muscle. Myocardium will use only fatty acid, not glucose and all. Okay, glucose kum cardiac muscle ko sambandhame illa. Well-fed state liyu seri, fasting state liyu only fatty acids. Okay, but all organs like liver, skeletal muscle, adipose tissue, brain, red blood cells, all these organs fuel is glucose except cardiac muscle, which whose fuel is fatty acid in well-fed state. In fasting state, mostly all will utilize fatty acid except brain and RBC. RBC is mainly depend upon glucose. RBC is main depend upon glucose in fasting and well-fed state. This is very important MCQ slide. Brain will use brain RBCs both will utilize glucose in fasting and well-fed state. Okay, but others will others fuel is fatty acid. For cardiac muscle, like Strava, ketones, so they will utilize. Okay, this is a very important slide. They will ask In fasting state, what is the fuel for brain? You have to write glucose. If ketones are there means we have to, in starvation, ketone bodies. Okay. Energy reserve of the body. Energy reserve of the body is triglyceride. Fat is the energy reserve of the body. Carbohydrate, triglyceride, protein, fibers, fat. That is fat is triglyceride which is present in the adipose tissue. So energy reserve of the body is mainly triglycerides. Serum acid phosphatase is raised in prostatic carcinoma. Prostatic carcinoma. Okay. Uh, because there will be they will confine within the capsule. Okay. Elevated level of acid phosphatase is seen in patients with carcinoma of prostate that is extended beyond the prostatic capsule. Patients with prostatic carcinoma will confine within the capsule. Usually have normal. If it extends, the carcinoma of prostate extends beyond the prostatic capsule means acid phosphatase will be extensively elevated. Okay, but if it is restricted means it will have normal. So depending upon by seeing the value itself, we can suspect this patient is having metastatic or that the primary is prostate. We can differentiate. Then all are glucogenic hormones except glucogenic hormones means which all the hormones which increases the blood glucose level. Glucogenic means increases the blood glucose level. So what are they? Anti-stress, stress hormones like glucagon, thyroxine and glucocorticoids. Glucagon, thyroxine, glucocorticoids. Antidiuretic hormone is secreted from, it is independent of glucose. It has no role in glucose. So we can rule out that. Okay, glucagon, thyroxine, glucocorticoids are all will control the blood glucose level. Okay, it increases the blood glucose level. ADH has no connection with glucose level. So we have to rule of exclusion. You have to select the answers. Okay, we have to see the all answers. By seeing one answer itself, you should not come to the conclusion. Okay, by seeing all the answers options, you have to select the correct answer. Antidiuretic hormone is nothing but vasopressin. It is secreted from posterior pituitary. It controls water excretion only. But there is no effect. It is independent of glucose. Glucose को इनको संबंधமே कड़ाया. So what are the glucogenic hormones which increases the blood glucose level? Glucagon, thyroxine, catecholamines, glucocorticoids, growth hormones. All these will increases the blood glucose level. Okay. So start codon. What is start codon? Start codon is the only one codon is start codon AUG. Okay, stop codon will have UAA, UAG, UGA. You have to know the answer. After knowing the answer only, you will be able to correctly choose the right option. Okay, start codon is AUG. Okay, AUG codes for methionine in eukaryote, for male methionine in prokaryote. Okay, so stop codon is UAA, UGA, and UAG. This you have to know. This is very important. Repeatedly asking question. Okay, start codon is AUG, which codes for methionine in eukaryotes. Stop codon is UAA, UAG, and UGA, which is cardioprotective, which is good cholesterol or cardioprotective. These are the different questions for HDL. HDL is a good cholesterol. HDL is cardioprotective. HDL maintains the reverse cholesterol transport. Okay. So what is cardioprotective? HDL. HDL is synthesized and secreted from liver and intestine. Okay, it transports the cholesterol from the peripheral tissue to the liver because liver is the factory which will metabolize the cholesterol. Cholesterol is harmful if it is gets deposited in the peripheral tissue. So it metabolizes the cholesterol, that is it transports the cholesterol from the peripheral tissues to the liver to get metabolized. Okay, so only it is cardioprotective, and HDL is inversely relative. So why it is a good cholesterol? If HDL is more, atherosclerosis will be less. And HDL will have the what are the apoproteins linked with HDL? ApoA1, ApoA1 and ApoC and ApoE. Main is ApoA1. And HDL will have the enzyme lecithin cholesterol acyl transfer, LCAT. Okay, which converts cholesterol into cholesterol ester. Then only it will be taken up by the HDL. LCAT is activated by ApoA1. Okay. Then coming to prostaglandin. Compound prostaglandin has been indicated in multiple conditions, is actually a derivative of which of the following. So what is this is a complex question, but prostaglandin is derived from arachidonic acid. So prostaglandinல இருந்து அரக்கிடானிக் ஆசிட் வருது. Prostaglandin are a group of physiologically active lipid compounds called eicosanoids. ஓகேவா? ஈகோசனாய்ட்ஸ் தான் வந்து ப்ராஸ்டோகிளாண்டின் வந்து ஒரு குரூப்ல இருக்கு. தட் இஸ் ஈகோசனாய்ட்ஸ். ஓகே, இட் இஸ் present in every tissue in human and animals. They are synthesized from arachidonic acid. So arachidonic acidல இருந்து தான் prostaglandins will be liberated. Okay, Cox pathway, lipoxygenase pathway we have seen in our classes. So Cox will produce thromboxane and prostacyclin. Thromboxane A2 and prostaglandin I2 will be synthesized using the enzymes thromboxane synthase and prostacyclin synthase. So arachidonic acid will is the precursor for prostaglandins, thrombocyclin, okay, all thromboxane, prostacyclin, prostaglandin, thromboxane will all derive from arachidonic acid. Arachidonic acid, uh, uh, from arachidonic acid only prostaglandins from prostaglandin arachidonic acid will be derived. Which of the following interfere with ion absorption? Ion absorption. What are the two forms of ion? Ferric and ferric. What is this? Ferrous. What is this? Ferric. So absorption form of ferrous is absorption form is ferrous form. Okay. So what is transferrin? Transport form is transferrin. Transport form of ion is transferrin. What is the storage form of ion? Ferritin. Ferritin is the storage form of ion. Transferrin is the transport form of ion. This and all you have to know. Many MCQs will be asked in the ion metabolism. So ferrous will be absorbed, will get absorbed. Okay. Ferritin is the storage form of ion. Transferrin is the transport form of ion. So transport form. Ferritin is the storage form of ion. Okay, what are the substances which increases the ion absorption? What are the factors which decreases the ion absorption? What are the factors which increases ion absorption is vitamin C. Main thing is vitamin C. We will give vitamin C along with iron for better absorption. So vitamin C will favors the ion absorption. But phytate, tannates, if you give milk, tea along with iron, it will not get absorbed. Tea contains tannins. Okay, so it will inhibit iron absorption. Milk also will inhibit iron absorption. So along with milk, you should not take iron tablet. Okay, so vitamin C increases the iron absorption. If the patient is having anemia, we can prescribe vitamin C along with iron. Okay, so what is among these, which are the inhibitors interferes with iron absorption? Phytate. Okay, maple syrup urine disease is due to deficiency of alpha keto acid decarboxylase. Okay, you answers you as you nearing the exams, you have to read the answers, not the options. Now you have to read the answers, then only you will complete your subjects fastly. Okay, so maple syrup urine disease is due to deficiency of alpha keto acid decarboxylase. Okay, what are the branch chain amino acids? What are the MCQs can be as valine, isoleucine, and leucine? Will valine, leucine, and isoleucine. Creatinine is formed from three amino acids: glycine, arginine, methionine. Will is the branch chain amino acids: valine, isoleucine, leucine. Okay, so maple syrup urine disease is due to deficiency of alpha keto acid decarboxylase. Okay, decarboxylase. So burnt sugar order will occur in maple syrup urine disease. These are the questions they will ask. Okay, branch chain amino acids will cause ketosis. These many MCQs will be asked in branch chain amino acids. Then coming to collagen. Collagen is rich in, I told you no, glycine is a repeating amino acid in collagen. Main amino acid in collagen is glycine. What is the vitamin which is responsible for activation of collagen? Vitamin C. Okay, iron for iron absorption also vitamin C. Collagen also vitamin C. And also bile acid synthesis வந்து 7 alpha hydroxylase is the rate limiting enzyme. This is again a rate important MCQ. This 7 alpha hydroxylase will also be activated by vitamin C. So many role of vitamin C. 7 alpha hydroxylase is the rate limiting step of bile acid synthesis. Vitamin C is responsible for that. Then vitamin C increases the iron absorption. For collagen formation, vitamin C is responsible for its action. Most repeating amino acid is glycine in collagen. What are the three amino acids? Main thing, glycine, proline, and hydroxyproline. Glycine, proline, and hydroxyproline, but glycine is the repeating amino acid. Okay, every third to fourth amino acid is glycine. This and this they will ask. Okay, which is the most abundant protein in the body is collagen. Nitric oxide is derived from. Nitric oxide is derived from L-arginine. You should not forget it. This is a repeating question. Arginine is nitric oxide is formed from derived from arginine. Arginine creatinine ko arginine irukku. Arginine, glycine, methionine. Okay. So it is synthesized from arginine by nitric oxide synthase. Okay. It has got many functions: muscle relaxation, neuronal signaling, and immune functions. So nitric oxide is derived from arginine. Then de novo synthesis of fatty acid require which coenzyme? Coenzymes are there here: NADPH, TPP, FAD, NAD. NADPH. NADPH is the cofactor which is coenzyme. It is responsible for synthesis of fatty acid synthesis. Okay. So fatty acid synthesis ku first enzyme and the acetyl-CoA carboxylase. Okay, it requires biotin, ATP, carbon dioxide and bicarbonate. Fatty acid synthase complex will have NADPH and thiamine, thiamine pyrophosphate. What is the active form of thiamine? Thiamine pyrophosphate is the active form of, this is one MCQ. TPP is the thiamine pyrophosphate is the active form of thiamine. Active form of methionine is S-adenosyl methionine. Okay, and NADPH is responsible for fatty acid synthesis, not NADH, NADPH. Okay. Which cell releases histamine? Always mast cells. This again, this will be repeating question in biochemistry pathology. Okay, so mast cells will releases histamine, not eosinophil. Okay, so mast cell will release a histamine heparin. Histamine is a vasodilator. It increases the permeability of WBC in blood vessels. So which vitamin responsible for iron absorption? Vitamin C. What all the factors which increases iron absorption? Increases absorption is vitamin C. Okay, decreases the iron absorption is phytate, which is present in cereals, pulses. After the lunch or after the breakfast, you should not take tea, but we will usually have no while on going to restaurant we will have, while after breakfast we are having no, that and all will inhibit the iron absorption. Phytate, tannins will be present in tea, coffee. Oxalates present in green vegetables. Calcium, you should not prescribe iron and calcium simultaneously. They should be taken in the morning. Iron can be taken, calcium can be taken at the night. You should not combine these two tablets while on prescribing the patient for iron deficiency anemia. Okay, that's like tetracycline. All will decreases the iron absorption. Vitamin C is the only facilitator of iron absorption. Then gluconeogenesis. Gluconeogenesis is inhibited by insulin. Insulin is the uh, hormone which inhibits gluconeogenesis. Why? Insulin is a key hormone that inhibits gluconeogenesis. Hallmark of type 2 diabetes is insulin resistance. What are the activators and inducers of gluconeogenesis? Glucagon, acetyl-CoA. Glucagon will increases the blood glucose level. Acetyl-CoA, citrate and ATP. These might be asked as a MCQ. Activators of gluconeogenesis: glucagon, acetyl-CoA, citrate and ATP. Inhibitors of gluconeogenesis are insulin, AMP, fasting state and diabetes. Okay. Inhibitors of gluconeogenesis are insulin, AMP, fasting state and diabetes. And which structure of protein is not denatured after heating up to 100 degrees Celsius? Primary structure, because they are held together by covalent bond. Covalent bond is the strongest bond. Okay, they will not disrupted by denaturation. Among these four structure, primary structure is not getting denatured. Okay, which of the following is present in skeletal muscle? GLUT4 or 5 or 7 or 2 or, this is an important MCQ. You have to see GLUT1, GLUT2, GLUT3, GLUT4. GLUT4 is the insulin sensitive. One more question they will ask. which is the insulin sensitive glucose transporter. Which is the insulin sensitive glucose transporter? GLUT4. Okay, this is one short answer. Sorry, this is one among the MCQ. What is the question here? Which of the following is present in skeletal muscle? GLUT4. Again, GLUT4, heart and adipose tissue. Heart, skeletal muscle, and adipose tissue. GLUT4 is very important. You should memorize it. Okay. GLUT1 is present in RBC, brain, kidney, pancreas. Brain, RBC. RBC all over the body it will present. Brain, kidney, pancreas. GLUT1, GLUT2, GLUT3, GLUT4. That and all you have to know. But all the things you have to know because they will ask any question. Among these only SGLT is there. SGLT is to transport glucose, not sodium. GLUT1 is present in brain, kidney, pancreas, RBC. GLUT2 is present in liver, pancreatic beta cells, and small intestine. GLUT3 is present in BKP, brain, kidney, placenta. GLUT4 is the most important one. This is insulin sensitive. It is present in heart, skeletal muscle, and adipose tissue. GLUT5 is present in small intestine. GLUT6 is present in spleen. GLUT7 is present in liver, endoplasmic reticulum. Okay. Bases which are present in human DNA: adenine, guanine, cytosine, thymine. Adenine, guanine, cytosine, thymine. Okay. Adenine, guanine, cytosine, uracil is RNA. What are the bases present in RNA? Adenine, guanine, cytosine, uracil. What are the amino bases present in DNA? Adenine, guanine, cytosine, thymine. Okay. Cashion's disease is due to deficiency of selenium. Cashion's disease is due to deficiency of selenium. You have to read the answers. Then only you will have the memory. You should not read the wrong options. Then that only will enter the mind. So you have to read the answers, correct answers. Okay, you have to mark in your MCQ note. Then only you have to read now for this 1 month. Okay. Cashion's disease due to deficiency of selenium. What is Cashion's disease? Is dilated cardiopathy due to deficiency of selenium. Okay, because it is named after the Chinese country Kashan, where the disease prevalence is high because of selenium deficiency. They will not ask these and all. Kashan's disease is due to deficiency of selenium. Zinc is a cofactor of which enzyme? Carbonic anhydrase. Among these, carbonic anhydrase. So, what are the cofactors for important enzyme? Carbonic anhydrase, dehydrogenases like alcohol dehydrogenase, lactate dehydrogenase, carboxypeptidase. Magnesium for kinases. Okay, zinc for carbonic anhydrase, alcohol dehydrogenase, lactate dehydrogenase, carboxypeptidase. So, magnesium for kinases. Kinase means hexokinase. Okay, ATP to ADP for all kinases will help. So, for kinases, magnesium. This is one more MCQ. Okay. Then allopurinol. Allopurinol inhibits xanthine oxidase. Xanthine oxidase will be inhibited by allopurinol. Why? In gout. What is the treatment for gout? Allopurinol can be given. Okay, allopurinol is the xanthine oxidase inhibitor. That's all. Allopurinol will inhibit xanthine oxidase. Okay, so it inhibits uric acid production. Okay, allopurinol inhibits xanthine oxidase and inhibit uric acid production. It decreases the uric acid level. 1 gram of protein yield how much of energy? Carbohydrate will yield 4 calories, kilocalories. Protein will yield 4 kilocalories. Fat will yield 9 kilocalories. Alcohol will yield 7 kilocalories. Okay. This is many MCQs are there in this question. Then most so carbohydrate and protein will yield 4 kilocalories. Fat will yield 9 kilocalories. Alcohol will yield 7 kilocalories. Most abundant amino acid found in is glycine. Glycine, proline, hydroxyproline. Which is the specific test for uric acid for gout? Synovial uric acid, plasma uric acid, urine uric acid, serum uric acid, synovial uric acid. Synovial uric acid is the because we can see the urate crystals when you see under the microscope. Okay, Hyperkalemia. What is hyperkalemia? What is a normal potassium level? Hyperkalemia means potassium level. Potassium level normal is 3.5 to 5 milliequivalents per liter or millimoles per liter. Okay. If it is more than 5.5 means hyperkalemia. Okay. If it is less than 3 means hypokalemia. Okay. So if more than 6.5 means they present with cardiac problems, arrhythmias might result. Okay. So for what is the normal level, you have to know. Then only you will be able to answer this question. 3.5 to 5 milliequivalents per liter. What is the normal sodium level? 135 to 145 milliequivalents per liter. This and all you have to know. 135 to 145 milliequivalents per liter for sodium. Potassium is 3.5 to 5 milliequivalents per liter or millimoles per liter. 99 to 109 milliequivalents per liter is for fluoride. Okay. For bicarbonate 22 to 26 millimoles per liter. In acid base balance, you are right. You read no. Then what are the all the following are the causes of hypercalcemia except hypervitaminosis of vitamin D, hyperparathyroidism, thiazides, not pancreatitis. Okay. What are the causes of hypercalcemia? Overactive parathyroid gland hyperparathyroidism and tuberculosis sarcoidosis, hereditary factors like familial hypocalciuric calcemia, immobility also will cause hypercalcemia, severe dehydration also causes calcemia, and lithium, thiazide, all will increases the calcium level. Okay. Which is a product of purine metabolism. Purine metabolism, uric acid. Purine metabolism, purine will get catabolized to uric acid is an important. Okay, what is the cause for gout? Xanthine oxidase inhibitor. Okay. Treatment for this is allopurinol, which inhibits xanthine oxidase inhibitors. Okay. So uric acid is normally excreted through the kidney. 2/3 of the uric acid will get excreted through kidney. 1/3 will undergo uricolysis in gut. Young male presents with recurrent bouts of diarrhea 2 hours after drinking milk. Diagnosis lactase deficiency. The patient might have lactase deficiency, so they cannot able to digest the lactose. Okay, after drinking milk, because milk contains lactose, so they are not possible to digest that because of absence of lactase. So lactose free product will be used. It should be used for that patient. Which enzyme deficiency is seen in Tay-Sachs disease? Hexosaminidase A. Hexosaminidase A is the enzyme deficient in Tay-Sachs disease. Okay. Niemann-Pick disease will be deficient in sphingomyelinase. Niemann-Pick disease, sphingomyelinase. Gaucher's disease will be deficient in glucocerebrosidase. So Tay-Sachs disease for hexosaminidase A deficiency is there. Sphingomyelinase will be deficient in Niemann-Pick disease. That and all you have to write it and paste on your room. Okay, then only you have to repeatedly revise it. Then only you will get memory. So, otherwise, you have to discuss with your friends. So, Tay-Sachs disease due to deficiency of hexosaminidase A. Gaucher's disease due to deficiency of glucocerebrosidase. Sphingomyelinase deficiency occurs in Niemann-Pick disease. What is flipped pattern? What as a heart patient suddenly has chest pain? Which isoenzyme of LDH is elevated? LDH1. LDH1 will be elevated in myocardial infarction. So, why? LDH1 is specific for heart, that you have to know. LDH2 is specific for RBC or blood. Okay. Normally, what happens? This RBC circulating in blood is circulating all over the body, no? So, normally LDH2 is more than LDH1. Okay. H1 வந்து ஹார்ட்ல தான் அதிகமா இருக்கும். LDH2 வந்து bloodல அதிகமா இருக்கும். Okay. So, நார்மலா வந்து blood அதிகமா இருக்கு இல்லையா நம்ம உடம்புல. So, blood is present in, sorry, LDH2 is present in blood. So, LDH2 is more than LDH1. This is normal. But in myocardial infarction, flipped pattern will happen. What is flipped pattern? This is one MCQ. Flipped pattern is seen in MI. Okay. What is flipped pattern? LDH2 is more than LDH1. LDH1 is more than LDH2. LDH3 is more than LDH4. Likewise, they will ask. You have to say LDH1 is more than LDH2 is the flipped pattern. LDH1 is present in heart. So in myocardial infarction, LDH will be secreted more. So LDH1 will be more than LDH2. That is flipped pattern. Okay. Two MCQs are there in this one MCQ. Then coming to what is the cofactor for mitochondrial superoxide dismutase? I told you no. Magnesium for kinase, zinc for carbonic anhydrase and dehydrogenase. Okay. Superoxide dismutase ka manganese. Okay, manganese is the cofactor for mitochondrial D, superoxide dismutase. But for cytoplasmic superoxide dismutase, copper is the cofactor. That you have to know. For manganese for mitochondrial superoxide dismutase, copper for cytoplasmic superoxide dismutase. Okay, two MCQs are there. Which of the following is involved in protein folding? Protein folding will be happen by chaperone. Chaperone are group of proteins that have functional similarity and assist in protein folding. So protein folding, this is important MCQ. Repeatedly asked question. Okay, protein folding na chaperones தான். Okay, degradation, protein degradation க்கு வந்து ubiquitin. Ubiquitin for protein degradation, for protein folding chaperones. Protein folding for protein folding chaperones, protein degradation ubiquitin. Okay, next. Which of the following is not given in a case of fatty liver disease? Fatty liver disease க்கு என்ன கொடுப்பாங்க? What is the term for that? Lipotrophic factor. Lipotrophic factor is nothing but it mobilizes the triglyceride from the liver to the peripheries. Okay, so it favors the uh, favors it overcomes the fatty liver disease. That is, for fatty liver disease patient, we have to give these lipotrophic factors. So it will mobilize the triglyceride which are deposited in the liver cells to the peripheries by essential fatty acid, polyunsaturated fatty acid. These are all will also mobilized. What are the factors? Choline, methionine, betaine, inositol, vitamin B9, B12, glycine, serine. So one of any question, any these among these, any factors can be given in the choices. Lipotrophic factors or except. Likewise, they might ask like choline, methionine, arginine, betaine. So except is arginine. So what are the lipotrophic factors? Choline, methionine, betaine, inositol, vitamin B9 that is folic acid, vitamin B12 is cyanocobalamin, amino acids like glycine, serine. So important MCQs like it is an important MCQ question. Okay. Least iron content is present in milk. Why? Why there is milk contains iron? Iron நிறைய இருக்கும் மில்க்ல. அதனால milk குடிங்கன்னு சொல்லுவாங்க. Why iron content is less in milk? Because which milk? That is cow's milk and breast milk will have low content of iron. Why means this iron present in the breast milk is bonded to lactoferrin and offers greater bioavailability. Okay, it will bound அந்த lactoferrin ஒரு அந்த காம்பவுண்ட் கூட வந்து இந்த அயன் வந்து பைண்ட் ஆகுறதுனால bioavailability is more, but it is poor in vitamin C. Highest iron it is poor in vitamin C. It bound with lactoferrin, so the iron content is less. Okay, so milk is poor in iron and also it is poor in vitamin C. Milk is poor in iron and vitamin C. But vitamin C யும் அயனும் இருந்தால் தான் அப்சர்ப்ஷனுக்கு நல்லா இருக்கும். அது ரெண்டுமே வந்து மில்க்ல கம்மியா இருக்கு. ஓகே, ஹையஸ்ட் அயன் கண்டென்ட் எது இதெல்லாம் இருக்கும் அப்படின்னா ட்ரைடு பம்ப்கின் seed, green leafy vegetables. Okay, then liver meat, beans, cashew, pista, all will have highest iron content. But milk will have low iron content and vitamin C. Then female patients presents with pain and redness in grade 2. Serum uric acid level is very high, like to 6 milligram per deciliter is normal in females, but here it is high. What is the prescribed drug and which of the following? What is we have completed this question. Allopurinol. Allopurinol can be given which inhibits xanthine oxidase. Okay. Which of the following amino acids required for synthesis of nitrate? This is also a repeating question. Arginine. Arginine is responsible for formation of nitric oxide. Then coming to 60-year-old man presented with chronic projectile vomiting. Vomiting is there and weight loss is there and electrolyte abnormality is seen in this patient. What is this? What is the diagnosis? Hypokalemic, hypochloremic metabolic alkalosis with hyponatremia. Why metabolic alkalosis? Because vomiters will have HCl, so it will be removed out. So alkalosis will be present. Okay, and also potassium loss will be there. We will see why the chronic projectile vomiting leads to metabolic alkalosis. Hyperaldosterone causes urinary loss of potassium and hydrogen ion. Okay, metabolic alkalosis is associated with always metabolic alkalosis associated with hypokalemia, hypochloremia, and hyponatremia. So this is the answer. You can straight away see the answer. Hypokalemic, hypochloremic, hyponatremia will be there in metabolic alkalosis. If metabolic alkalosis is the main maximum thing is there means metabolic alkalosis accompanied by hypokalemia, hyponatremia, and hypochloremia. So we can answer straight away we can choose this correct answer. Okay, what is the fluid correction for metabolic alkalosis is normal saline. What is the fluid correction for metabolic acidosis? Ringer lactate. Then coming to 75-year-old patient presented with back pain. 75 years old patient present with back pain, increased ESR. Then multiple punched out lesions will be there. What is the investigation to be done? Serum electrophoresis for multiple myeloma. I think madam has covered this. Then what is the 25-year-old male patient is having loose stools 18 times per day and his urine is frequently reduced. So oliguria is there. What will be the correct finding of this patient? Hyperosmolar urine. Urine sodium is more than 40. Kidney biopsy shows glomerular damage. Post-renal azotemia. Pre-renal azotemia means we can say because fluid loss is there means we can if the fluid pre-renal azotemia is there means we can say, but here it is post-renal azotemia. So why there is hyperosmolar urine? Usually if multiple times loose stool is there means the patient will present with acute kidney injury. Okay, always have in memory if there is any acute fluid loss is there means the patient might present with acute kidney injury. Okay, so there will be conservation of fluid. So only concentrated urine will be there. That is hyperosmolar urine. This is the clinching point. Okay, so urine sodium more than 40 leads to salt wasting. Is a here the postrenal is present in the obstruction beyond the kidney, that is BPH, vesicoureteric reflex, bladder outlet obstruction, all will have postrenal. If pre-renal azotemia is there, means we can, that is one more correct answer. Here, acute kidney injury, there will be conservation of fluid, so hyperosmolar. Hyperosmolar means concentrated urine will be there. So, patient will have the concentrated urine because of maximum vomiting. Sorry, loose stools. Which of the following is not a micromineral? Zinc is a micromineral. Copper is a micromineral. Iodine is a micromineral. But calcium is a macromineral. Okay. Increased amount of phytate leads to deficiency of iron. We have read it multiple times. Decreased the okay. Decreases iron absorption of phytate, oxalate, phosphate, tannate. Increases iron absorption is vitamin C mainly. Cysteine, acidic pH. What is the location of lactate dehydrogenase inside the cell? That is enzyme marker. Enzyme marker of each organelle you have to read. Okay, Golgi apparatus, galactosyl transferase. Okay, Golgi apparatus, galactosyl transferase. For mitochondria, ATP synthase, cytosol, LDH. Okay, that and all you have to know. Okay. A woman after hysterectomy presents with distended abdomen. What is the electrolyte balance? Hysterectomy patient. Hypokalemia. I told you, no, what is the normal potassium level? 3.5 to 5 millimoles per liter. More than 5.5 is hyperkalemia. Less than 3 is hypokalemia. Okay. Here, intracellular shift. Because of intracellular shift, metabolic alkalosis, insulin, beta 2 agonist, all will cause intracellular shift. Okay. And the patient will presented with, but here many important questions should be added. Patient will have T wave inversion. Likewise, they may include in this. They should have included in this. So hypokalemia changes should be included in this question. Okay. A woman after hysterectomy presented with a distended abdomen, having the ECG of T wave inversion, prominent U waves. Okay. But if they given like that, we can write it correctly. Choose the answer as hypokalemia. Okay. Lesch-Nyhan syndrome. Lesch-Nyhan syndrome is due to deficiency of hypoxanthine guanine phosphoribosyltransferase HGPRTase deficiency. HGPRTase deficiency. This is the enzyme defect in Lesch-Nyhan syndrome. It is an important MCQ. It is an X-linked recessive disorder. X-linked recessive disorder carried by the mother, passed on to her son. Okay. So, Lesch-Nyhan syndrome is due to deficiency of HGPRTase deficiency. Then, which of the following protein does not have quaternary structure? Which does not have quaternary structure? Hemoglobin, collagen, insulin, myoglobin. Hemoglobin, collagen, insulin will have the quaternary structure. Myoglobin is a simple protein containing of single polypeptide. What is oligopeptide? What is dipeptide? What is tripeptide? What is polypeptide? What is protein? Dipeptide means two amino acids linked by peptide bond. Dipeptide. Tripeptide means three amino acid linked by peptide bond. What is the example for tripeptide? Glutathione. Glutathione is it is one among the MCQ. Glutathione is the tripeptide. It consists of gamma glutamyl cystinyl glycine. So glutamic acid, cysteine, glycine. This you have to know. Glutathione is made up of gamma glutamyl cystinyl glycine. So glutamic acid, glycine, cysteine will be there. This is tripeptide example. Oligopeptide means less than 10 amino acid. Polypeptide means more than 10 up to 50 amino acids. Protein means more than 50 amino acids. This you have to know. Okay. Then quaternary structure இல்லாதது வந்து myoglobin தான் because it is a simple protein containing of single polypeptide. Okay. But we are dealing with protein. Protein means more than 50 amino acids, but myoglobin means it is a single polypeptide. Polypeptide contains less than 50 amino acids. Okay. A newborn develops vomiting, irritability, lethargy several days after birth. Her mother states that his diapers smell like burnt sugar. Burnt sugar means straight away you can say the diagnosis as maple syrup urine disease. What is the maple syrup urine disease? Is D branch chain alpha keto acid dehydrogenase complex. Okay. Dehydrogenase is there, decarboxylase is also there, but here branch chain alpha keto acid decarboxylase should be there. So phenylketonuria is due to deficiency of phenylalanine hydroxylase. Alkaptonuria is due to deficiency of homogentisate oxidase deficiency. Maple syrup urine disease is due to deficiency of branch chain keto acid dehydrogenase or decarboxylase. Okay, this is important MCQ. This three you have to know repeatedly asking question. Then most common type of collagen seen in fibrous cartilage of joints is type 2. Type 2 is the most common type of collagen present in fibrous cartilage. This you have to know. Type 1 is present in. Type 2 is present in. Type 1 is present in bone, skin, dentin, cornea, blood vessel, fibrocartilage. You have to write it and paste it paste it and read multiple times. Bone, skin, teeth, cornea, blood vessel, fibrocartilage and tendon. Type 2 is present in cartilaginous tissue. So 2 is present in cartilage, 1 is present in bone and skin. Bone, skin, teeth வந்து type 1. Type 2 வந்து cartilaginous tissue. Type 3 வந்து Skin, ligament, blood vessels, internal organ. Type 4 இது ஞாபகம் வச்சுக்கோங்க. Basement membrane. This will be asked multiple times. Type 4 collagen is present in basement membrane. GLUT4 is uh, GLUT4 is present in heart, adipose tissue, skeletal muscle, which is insulin sensitive. So 444 ஞாபகம் வச்சுக்கோங்க அப்படி. Then remaining is synovium, corneal stoma, 5. So specifica வந்து bone, skin, teeth in type 1, cartilage in type 2, skin, ligament type 3, basement membrane is type 4. Xeroderma pigmentosa is a type of DNA repair defect. It is due to nucleotide excision repair. Okay, nucleotide excision repair defect is present in Xeroderma pigmentosum. நிறைய இருக்கு, அதை have to read. 25-year-old female present to the medicine OPD with acute abdominal pain for which exploratory laparotomy was done. She was accompanied by neuropsychiatric symptoms and the urine sample turned to black with time and room temperature. Most likely diagnosis acute intermittent porphyria. Okay. Neuropsychiatric after surgery, after abdominal pain, neuropsychiatric is there means, and black urine turns black means you have to suspect acute intermittent porphyria. We can see in the next class what are the types of porphyria and okay. Storage form of neutral lipid in our liver is triglyceride. If triglyceride is more means it will stored in liver and peripheral tissue and it will cause damage. Okay, storage form of fat is triglyceride. So the following is a cofactor for glutathione peroxidase, selenium. I told you no, zinc, carbonic anhydrase, dehydrogenases, manganese is for mitochondrial superoxide dismutase, copper for cytoplasmic superoxide dismutase, selenium for glutathione peroxidase. Okay. There are 3 enzymes for selenium: glutathione peroxidase, 5' deiodinase, thyrodoxine reductase. All these 3 enzymes. For selenium, glutathione peroxidase, 5' deiodinase, and thyrodoxine reductase. This is an important MCQ. Glutathione peroxidase, 5' deiodinase, thyrodoxine reductase. Then coming to hormones and endogenous substances that are involved in regulation of calcium. Vitamin D, PTH, calcitonin, not insulin, not TSH. So we can select by rule of exclusion. Okay. Vitamin D, PTH, calcitonin all will regulate the calcium, not insulin, TSH. Okay. Vitamin that increases iron, vitamin C. 5-year-old boy has hyperflexible fingers. Hyperflexible nave Ehlers-Danlos. Okay. Can touch back of the hand with wrist extended means Ehlers-Danlos. It is an inherited disorder that affects your connective tissue, primarily your skin, joint, blood vessels. Okay, it is a mixture of proteins which provide a strength and elasticity. So, for Marfans, they will give long stature with the mitral regurgitation. Likewise, they will give the clues. But here, hyperflexible fingers means Ehlers-Danlos due to connective tissue disorder. Then hormones that regulate serum calcium, again calcitonin, vitamin D, parathyroid hormone. More content, sodium content is present in cereals, green vegetables, loaf of bread, canned soup. Sodium content is high in loaf of bread. Sodium content cereals la வந்து 6 milligram per 100 gram, green leafy vegetables la 79 milligram per 100 gram, loaf of bread la வந்து 1.13 grams per 100 gram. Soups la வந்து 600 to 800 milligram per cup. Okay. Then 10-month-old is undergoing treatment for diarrhea and hypokalemia. However, in spite of potassium correction, child does not improve and flappiness is noted, which is the condition: albumin deficiency, calcium deficiency, phosphate deficiency, magnesium deficiency. There will be magnesium deficiency because hypokalemia and hypomagnesemia will always coexist. So children who are all malnourished with diarrhea present with magnesium deficiency mostly. So hypokalemia happens means they will not improve. You have to give magnesium supplement also. Okay. So potassium, magnesium will coexist. In an adolescent patient presenting with short duration illness and starvation, lab evaluation shows unconjugated hyperbilirubinemia with normal liver enzymes, which condition should be suspected. What unconjugated chronic pancreatitis? Illa. Why? Because if chronic pancreatitis means alcoholism should be the clinching history, triglyceridemia should be there, no, nothing is there. So you should rule out acute pancreatitis. Viral hepatitis can be ruled out because normal liver enzymes. Rotasa, Gilbert. Unconjugated causes enna, conjugated causes enna. What are the congenital causes? Congenital causes of unconjugated hyperbilirubinemia, Gilbert and Krigler-Naegler. கில்பர்ட்டும் ரிக்லர் நெஜ்லரும் வந்து அன்கான்ஜுகேட்டட். கான்ஜுகேட்டட்க்கு வந்து டுபின் ஜான்சன்ஸும் ரோட்டாரும். இங்க என்ன கொடுத்துருக்காங்க? அன்கான்ஜுகேட்டட் இஸ் எலிவேட்டட். ஸோ what is the thing present here? Gilbert syndrome. Gilbert syndrome is a thing where the defective UDP glucuronide transferase so increased unconjugated hyperbilirubinemia. These two you have to know. What are the congenital causes of unconjugated hyperbilirubinemia? Gilbert, Krigler-Naegler. What is conjugated and hyperbilirubinemia congenitally happen? Dubin Johnson, Rotor. This Gilbert is not present in young children க்கு கொடுக்கல. இங்க வந்து adolescent because Gilbert's patient will survive. They will have higher survival rate. So only they have given the clue as adolescent patient with unconjugated hyperbilirubinemia with normal enzymes. We have to by rule of exclusion, we have to come to the conclusion as Gilbert syndrome. What do you expect in a lady after gallbladder removal most commonly? What is that? Steatoria. Because bile will not will not be there for excretion. It is responsible for gallbladder is responsible for storage and concentration and acidification of the bile. It helps in emulsification of the fat. Okay. Cholecystectomy aprom bile physiology will be altered, leading to malabsorption of fat, leading to steatoria. Fecal steatoria more than 7 grams per 24 hours. ஸோ என்ன வந்து காமனாக இருக்கும் அப்படின்னா ஸ்டியட்டோரியா இஸ் த காமன் அதாவது திங் present after cholecystectomy. 7-year-old child with recurrent history of jaundice comes to OPD. Lab test detected the UDG is decreased. That is same answer, Gilbert's. So what is the unconjugated hyperbilirubinemia child சொல்லிட்டாங்க. They will survive, no? 7-year-old child. So Gilbert syndrome. Fat sugar baby appearance is seen in Kwashiorkor. Okay. Marasmus will be emaciated. Menkes disease is due to deficiency of copper. Wilson's disease is due to deficiency of copper. What is the defect? Gene defect is 7 ATP7B defect is Wilson. Menkes in 7A. Okay. Menke-Kinky is air syndrome. Menke-Kinky air syndrome is due to defective ATP7A gene. Wilson's disease is due to defect in ATP7B gene. Okay. Then coming to 60-year-old male present with bony pain. His calcium level is very high. 9 to 11 is normal. Normal calcium level is 9 to 11 milligram per deciliter. Here it is elevated. As per image, histiocytosis, Page's disease, hyperpathons, இது madam has covered, no? Crab is hypercalcemia, renal failure, anemia and bone pain. Normal level of ALP is present in, what is the normal level of ALP is seen in osteoporosis, Page's disease, multiple myeloma, vitamin K deficiency, osteoporosis. Diagnosis வந்து bone density scanல பண்ணுவோம். Osteoporosisல வந்து ALP will be normal. ALP will be normal in osteoporosis. Cholesterol is synthesized from acetyl-CoA. So cholesterol is synthesized from acetyl-CoA. Okay. And bile acids are also synthesized from acetyl-CoA. Sorry, ketone bodies. Ketone bodies, acetyl-CoA is required for fatty acid, cholesterol, triglyceride synthesis and ketone body synthesis. Okay. Patient presented with the polyuria with no presence of sugar, what could be the diagnosis? Sugar கிடையாது, glucose கிடையாது யூரின்ல, polyuria இருக்குனாவே என்ன diagnosis? SADH, diabetes insipidus, type 2 diabetes, type 1 diabetes. Type diabetes insipidus is the answer because there is no, it's not dependent on glucose, it is dependent on ADH. So no ADH means central diabetes insipidus. If it is resistance to ADH means peripheral or nephrogenic ADH. Polyuria na more than 50 ml per kilogram per 24 hours. Okay. ஒரு 24 ஹவர்ஸ்க்கு வந்து per kilogram body weight க்கு more than 50 ml இருந்தாலோ இல்ல more than 3.5 liters per 24 hours இருந்தாலோ that is polyuria. Okay. Water deprivation test பண்ணி ADH sorry diabetes insipidus rule out பண்ணலாம். Enzyme defect in galactosemia is galactose 1-phosphate uridyl transferase. What is the enzyme defect in galactosemia? Galactose 1-phosphate uridyl transferase. It converts galactose 1-phosphate to UDP glucose. Straight away you read the answer for this and all. You should not get confused with all by reading all the answers. Okay, you have to tick the correct answer, then you straight away read the answers for this revision. Enzyme defect in galactosemia is galactose 1-phosphate uridyl transferase. What happens after meal? Insulin. Insulin is an anabolic hormone. It is released in the fed state. So it increases the insulin level, decrease in glucagon level. What happens after meal? Increase in insulin level, decrease in glucagon level. Insulin is an anabolic hormone released in fed state, where glucagon is a catabolic hormone released in fasting state. A child present with low BP, clitoromegaly, which enzyme deficiency is suspected here? 21 alpha hydroxylase. Okay, 21 hydroxylase. Okay, 21 beta hydroxylase. Most common, this and all in biochemistry, they will, if the having the patient is having low BP, had clitoromegaly, 21 beta hydroxylase is the answer. Insulin stimulates glucose uptake by cells via GLUT4. I told you, no. This is, what is an example of this is facilitated diffusion. It involves carrier molecules specific for each solute. So example for transporter, that is stimulates, insulin stimulates glucose uptake by via GLUT4 is facilitated diffusion. Most common type of macrocytic anemia in India is chronic alcoholism. Okay. B12 deficiency la தான் வந்து macrocytic anemia வரும். Okay. Why chronic alcoholism is the answer is B12 deficiency will be there. They will not eat much. Folate deficiency will be there. Alcohol will be toxic to the marrow. So abnormal erythropoiesis and megaloblastic RBCs will be there. And also one more thing is there for B12 deficiency, pancytopenia will be present. Pancytopenia means what? Anemia will be there. Leukopenia will be there. Thrombocytopenia will be there. Okay, that is pancytopenia. If you see pancytopenia, we can to suspect B12 deficiency. In fasting state, secretion of glucagon aims to produce glucose mainly by fasting state. Glucagon will be more. So it increases a cyclic AMP. Answer is B. It produces glucose mainly by gluconeogenesis and glycogenolysis. Okay. In fasting state, in fed state, insulin will be there. Okay, so glycolysis will be there. But in fasting state, secretion of glucagon will produce glucose mainly by gluconeogenesis and glycogenolysis. Which of the following type of hexokinase is mostly released from hypothalamus? Hexokinase 4 is also known as hypothalamus release agra hexokinase and hypothalamus hexokinase 4, otherwise known as glucokinase. It is present in the pancreatic beta cells. Okay, va? Hexokinase 1 is more abundant and it is a housekeeping type of the enzyme. That is, it is the main thing present. It is responsible for glycolysis in all the cells. Hexokinase 4, glucokinase is also known as glucokinase, present in beta cells. Peripheral conversion of T4 to T3 is done by deiodinase. I told you, no. What is the selenium dependent enzyme? I told you, no. Selenium dependent enzymes are glutathione peroxidase, 5' deiodinase, thyrodoxine reductase. So deiodinase is a selenium dependent enzyme. Also selenium cysteine containing enzyme. It is helps in conversion of T4 to T3. So the following is true regarding Michaelis-Menten equation. Michaelis-Menten Km is directly proportional to substrate concentration. Km is directly proportional to substrate concentration. Middle-aged patient on workup revealed to have suffered from rare form of pyruvate dehydrogenase deficiency having high anion gap metabolic acidosis. What is the best dietary advices? We have to give high fat and low carbohydrate diet. High fat, low carbohydrate diet. Patient will have high anion gap metabolic acidosis. Okay, va? What is a tall obese patient? இதுக்கு என்ன explanation-னா this patient is having high anion gap metabolic acidosis. Okay, this patient is having high anion gap metabolic acidosis. Pyruvate deficiency is there. Pyruvate எங்க இருந்து வருது? Carbohydrate, glucose. Okay, this glycolysis and Krebs cycle are linked by pyruvate to acetyl-CoA. இந்த pyruvate dehydrogenase complex மூலமா தான் acetyl-CoA வருது. ஓகேவா? this pyruvate dehydrogenase complex ஒர்க் ஆகல. ஸோ என்ன ஆகும்? pyruvate வந்து அதிகமாயிடும். pyruvate வந்து acetyl-CoA கன்வெர்ட் ஆகாது. ஸோ PDH is deficient here. ஸோ pyruvate வந்து அதிகமாக இருக்கு. This pyruvate வந்து converted to lactic acid. Okay. So only we have to கம்மி பண்ணணும். என்ன கம்மி பண்ணணும்? கார்போஹைட்ரேட்டை கம்மி பண்ணி ஃபேட்டை அதிகமாக கொடுக்கணும். Then tall obese patient was worked up to have recently developed metabolic syndrome. ஓகேவா? So what is the most likely thing present in this patient? Metabolic syndrome is a hyperglycemic state. Here triglyceride is more, total cholesterol is more. Uric acid க்குலாம் சம்பந்தம் கிடையாதுங்க. Okay, metabolic syndrome we will see in the next session. Which of the following would help in explaining mechanism of atrial natriuretic peptide? Mechanism of atrial natriuretic peptide is responsible for preventing sodium water retention. Okay, natriuresis prevent பண்ணும். Okay, apart from they are responsible for vasodilation and leads to release of nitric oxide, which is done by cyclic GMP second messenger. So atrial natriuretic peptide வந்து cyclic GMP மூலமா atrial natriuretic peptide னா AMP வழியா வராது, cyclic GMP வழியா தான் ஆக்ட் பண்ணும். Okay, atrial natriuretic peptide acts via cyclic GMP as a second messenger. True about Atkins diet. Atkins diet na low carbohydrate diet, low calorie, low carbohydrate, high protein, high fat diet. This Atkins diet. Low calorie, low carbohydrate, high fat, high protein. In long chain fatty acid enzyme deficiency, which of the following are true? Which of the following are true? All are true. Hypoketotic hypoglycemia, hepatomegaly, cardiomyopathy. Long chain acyl-CoA dehydrogenase deficiency la it is transmitted as autosomal recessive. So it's not possible to break down the long chain fatty acid complex. Fatty acid break பண்ண முடியாது because of the enzyme deficiency. So they will present with hypoketotic hypoglycemia, hepatomegaly, cardiomyopathy. In type 1, type 2 diabetes, which products will rise? Blood glucose will rise because there will be insulin resistance. Insulin will be there, but it will be resistant to act. So glucose uptake will be less. So blood glucose will be high. Middle-aged man on urine examination shows Bence-Jones protein. Bence-Jones protein பார்த்தீங்கன்னாவே என்ன சொல்லணும்? Multiple myeloma. So இதுல வந்து என்ன chains will be there in urine? Kappa chain, lambda chain, delta chain, beta light chain. Light chain myeloma can classified as lambda or kappa lab. Okay, but kappa is ratio is more, so kappa light chain will be mostly expected. Middle-aged man presented with hypercalcemia, same thing, multiple myeloma. Child visited the hospital with her mother with complaints of severe fatigue, pallor is there, irritation is there, iron deficiency anemia, iron supplements are being given. Iron இதெல்லாமே கொடுத்துட்டாங்க. What test to be done is ferritin. Ferritin பார்த்தா ஸ்டோரேஜ் இருக்கா இல்லையா அப்படின்னு தெரிஞ்சுக்கலாம். ஓகேவா? ஸ்டோரேஜே இல்ல அப்படின்னா we have to treat accordingly. ferritin level லோவா இருக்குன்னா இன்னும் ட்ரீட் பண்ணணும் நல்லது. ஓகேவா? most abundant plasma protein is albumin. Albumin is the most abundant plasma protein. இதுல சிம்பிள் கொஸ்டின் தான், நம்ம வந்து குழம்பிப்போம். குளோபுலினா ஃபைப்ரினோஜினா அப்படின்னு ரொம்ப இதாக கூடாது. வாட் இஸ் த மோஸ்ட் abundant plasma protein? Albumin. Simple. Known case of diabetic patient came to hospital with pigmentation of skin over the arms. He also found to have suffering from micronodular cirrhosis. Diabetes இருக்கு, pigmentation of the skin இருக்கு, micronodular cirrhosis இருக்கு, iron depositsலாம் seen ஆயிருக்கு இருக்கு. So what is the thing? Iron deficiencyக்கு வந்து இந்த பேஷண்ட்க்கு வந்து ட்ரீட் பண்ணியிருக்காங்க. என்னவா ட்ரீட் பண்ணியிருக்காங்க? அயன் நிறைய ஓவர்லோட் பண்ணியிருக்காங்க. ஸோ திஸ் பேஷண்ட் இஸ் ஹேவிங் ஹீமோக்ரோமட்டோசிஸ். ஸோ வாட் இஸ் bronze diabetes? What is bronze diabetes? Diabetes is there because of involvement of pancreas. This pigmentation of the skin is there. Micronodular cirrhosis is there. So hemochromatosis will have bronze diabetes. Most common cirrhosis. Okay, va? 2-year-old multiple history of jaundice, mild hepatosplenomegaly, unconjugated hyperbilirubinemia, in pigmentation, blue yellowish discoloration in sclera. What is the diagnosis? Unconjugated is the Gilbert or Crigler nature. Gilbert is most common. Okay. Why sclera is having more affinity? Why is in sclera, why it is appeared, this yellowish discoloration appear more prominent in sclera? Because sclera has got high affinity to elastin. It has got high elastin. Bilirubin will have more affinity to elastin. So only sclera will be the yellowish discoloration will be more prominent in sclera. This is one among the MCQ. You can see in the next class.